Welcome, everyone. I'm Tony Bernardo, Dean of UCLA Anderson School of Management, and I'd like to welcome you to this evening's event hosted by the Centers at Anderson. Our centers at Anderson act as hubs for leadership insights, faculty research, student and alumni engagement, and service to our communities and society. Our centers operate in areas such as finance, real estate, entrepreneurship, technology, media and entertainment, marketing analytics, and global issues that transcend borders. The leadership discussion today is part of a series of discussions created by our centers, collaborating in an effort to share expertise, learnings, and best practices across all disciplines, and to bring greater awareness of the problems and opportunities in the world around us. Today's discussion is also in collaboration with UCLA's Fielding School of Public Health, which has been a terrific cross-campus partner for UCLA Anderson, and we look forward to expanding our relationship with the school over the coming months. We live in a world today with huge challenges and opportunities. We believe the solutions to society's most vexing problems are fundamentally interdisciplinary, using notable best practices from abroad and requiring new modes of engagement with our employees and communities. Tonight's program on the learnings from abroad on COVID-19 is a great example of the spirit of collective effort and collaboration brought forward by our centers with the Fielding School. So let me please now introduce Terry Kramer, Faculty Director of our UCLA Anderson Easton Technology Management Center, who will be moderating tonight's program. Terry?
Good. Tony, thank you very much. And let me just add my own welcome and thank you to what is now our second program in our leadership series, again in collaboration with the Centers at Anderson and also the Fielding School. And Tony, I just want to thank you again for your own leadership on this, helping guide the school to think about how leadership is changing in the current environment. And as you know, we're going to be covering a very relevant topic related to that, COVID-19, what our learnings are from abroad. I hope you find this to be very engaging and timely. And I thought I'd start out by just sharing a few statistics here about the status of COVID-19 here in the US as well as abroad. So first of all, there now on a global basis are more than 20 million cases of COVID-19, more than 750,000 deaths. Here in the US, on a proportionate basis, the statistics are even worse, with more than 5 million cases, which is about 25% of the world's cases here in the US, even though the US only has about 4% of the world's population. In terms of the number of deaths, there are now over 166,000 deaths here in the US, and again, represents almost 1/4 of all the deaths in the world, despite the US having just 4% of the world's population. And while some people can say COVID-19 hit the US later, and there's reasons why the situation would be this bad, we only need to look at Europe to see what was early on a very high incidence, but yet a notable improvement that has occurred over the past few months. All of this then raises the fundamental question about leadership here. What does effective leadership look like in this context? We often think of leaders as fundamentally needing to be able to look at the context or the environment around them and to devise a direction or strategy that's appropriate. In many cases, they look at benchmarks to say, what's happening outside my own world, and can I apply those benchmarks to drive success? In this program, we hope to understand better these leadership imperatives, and specifically, we want to look at the role of several elements here. What is the role of technology in relation to COVID-19? What is the role of data and science? What is the role of government versus business versus individuals, and what's the role of a nation's culture in driving specific actions? Now, I can't think of a better panel and a more diverse panel to cover these issues and a variety of views than the ones that we have today. So first of all, we have Jeongmin Seong, who is a McKinsey Global Institute partner in their Shanghai office. And he's written a fascinating article regarding his research on how technology is safeguarding health and livelihood in Asia. This article was co-authored by Lily Ma, who is also here with us. She's also based in Shanghai, and she's a rotational fellow who currently is leading the technology module at the Institute for its Future of Asia series. We also have Chandran Nair with us, the founder and CEO of the Global Institute of Tomorrow. Chandran's got a very broad view about global issues, including the shift of economic and political influence from the West to Asia, and the dynamic relationship of business and society, and the reshaping of rules of capitalism. Finally, we have UCLA's only Dr. Robert Kim-Farley. He serves as a professor with a joint appointment in the Department of Epidemiology and Community Health Sciences at the UCLA Fielding School of Public Health. And from 2004 to 2018, he served as director of the Division of Communicable Disease Control and Prevention at the Los Angeles County Department of Public Health. He's also had a variety of senior roles with the Center of Disease Control, the World Health Organization, and USAID. So he brings an interesting global perspective to complement his US expertise. Now, in terms of the format for today's session, I'm going to start out asking the panelists a variety of questions to better understand their point of views, their recommendations, and then we'll go to audience Q&A. We'll use Slido for the audience Q&A. The Slido event code is 89020. Again, 89020, and I will endeavor to ask the most popular questions. So let me now start out with the questions here, and Jeongmin and Lily, let me start with you. You know, you've conducted very interesting research here and specifically identified 6 ways that technology has helped contribute to more positive outcomes in Asia regarding the COVID-19 pandemic. If you could give us a brief summary of those, that would be terrific.
Thank you very much, Terry. So I've been working in China for the past 15 years, but I'm Korean. And at the end of January, I went back to Korea to celebrate, Lunar New Year. And then in March, I flew back to Shanghai. And as I flew back to Shanghai, I went through, personally went through 14-day quarantine process. I initially concerned about my, 8-year-old daughter, but she was a digital native and she actually went through it very well. She played a lot of games, watched lots of video clips, right? But then, it was a very, painful and tough experience for me. So I'm happy to share my personal experience as well, right? In this process. So, going back to that, our research topic on COVID-19. So we believe that, we are facing, dual crisis, and as a result, we have dual mission. The first mission is about saving lives, right? Addressing, public health issue. And then second mission is about, saving livelihood, which is about, minimizing the impact on the economy and the disruption. And in our research, we looked at 6 ways or 6 application of technologies, 3 related to the first one and another 3 related to the second one. And let me briefly frame this, and I invite Lily to share some examples. The first 3 related to public health or saving lives. The first application was about track and trace and testing. So Terry, you mentioned those big numbers in terms of confirmed cases and death. What is different for this COVID-19 versus SARS and MERS situation is so-called high rate of reproduction. And the application of QR code, GPS and Bluetooth, and also the usage of telecom data, payment data, were widely used in some of the Asian countries, to lower the reproduction rate in Asia. So that's the first application. Second application is about the expansion of healthcare capacity. Many countries and many cities, they experience, surging number of patients, therefore shortage of healthcare capacity. And technology helped lessen the pressure, right? and expanding the healthcare capacity. For example, China built a 1,000 bed hospital in just 10 days. That was enabled by so-called beam technology, right? And some of the hospitals use AI to scan the lung images that can also be helpful in terms of prioritizing the patients and so on. So that's the second application. Third application is communication. So there was a delivery of real-time information about the cases, related information on the virus, and also availability of some of the critical supplies such as masks. And that was widely used and adopted by many Asian users. So those three were related to the first mission, which is about addressing public health challenges. The next three is about the saving livelihoods, about the economy. The fourth technology is about the massive digitization of products and services in many sectors. And around the world, we hear a lot of news about e-commerce, delivery, and live streaming and so on, which is not surprising at all. What COVID-19 has done is the acceleration of digitization in less digitized part of the sector and economy. For example, education, real estate, entertainment. In China, there was even an online tomb sweeping services, for example. So that's the fourth, and that was very helpful in terms of keeping the economic activities going. The fifth technology is about the enabling new working model, especially work from home model. In my PC, I have 6 different versions of work from home tools, and I was very surprised that many local companies in China, Philippines, Indonesia, and Singapore, they become an active user of those tools. So that was the fifth, and that was very helpful in terms of keeping the employment as well. And number 6 is about facilitating labor deployment across different sectors. One part of the economy, they were suffering, they were struggling. Another part of the economy, they were thriving, right, because of the surging demand. And these technology tools, they facilitated this cross-company, cross-sector labor deployment, which was again, very helpful in terms of generating incomes for the workers. So those were the 6, and I invite Lily, my colleague, to give some examples as well.
Thanks, Jeongmin. As Jeongmin mentioned, there are quite a number of solutions in different Asian countries, so I'll highlight 3 here. Going with what Jeongmin mentioned as this watertight quarantine cycle, in China, one of the most frequently used COVID-related health technology, even in these days, is what we call the health QR code. So it is a 3-color health code that flags how strictly a particular individual needs to be quarantined. So whenever we go into an office building or subway stations, we're required to show the QR code. If it's green, we're free to enter. If it's yellow, typically need to be quarantined for 7 days. And then if it's red, that means this particular person has been to a high-risk area and needs to be quarantined for 14 days. And then in countries like Korea, so I was actually personally in Korea in around mid-February when the numbers started to pick up, and very quickly my friends in Korea introduced me this app called Corona Map. It shows the travel history of confirmed patients, and it's very detailed. It's a map, and you can show wherever you go. It flags if a confirmed patient has been here within last 24 hours or last 24 hours to 4 days or over 4 to 9 days. And in this way, people can actively avoid these areas. And that was really helpful for me. And then in Singapore, I'll highlight that this again, some of my Singaporean colleagues told me they could subscribe to WhatsApp government channel and then get daily update on very detailed information of all the new cases, where these people have been to, what's their kind of general background to help understand the overall condition of the pandemic in the nation. So these are some notable specific examples for context.
Excellent. So let me ask you, I'm trying to kind of think of the common themes across all 6. And I jotted down 4 common themes that really kind of are indicative of the solution. One is obviously technology. Another one is agility of response and resource allocation. A third one is coordinated action. coordinated action, it sounds like from government, citizens, et cetera. And the fourth thing is new models of operating. If you were to look at those, and you can add others if you've got it, and ask, if I were to ask a question, how much of this is transferable to the US? Obviously, you travel a lot here in the US. Which of these things do you say is transferable and should be able to be adapted? And which do you say, you know what, context is completely different and this is not practical to import?
Yeah, so in my view, everything is transferable, right? In principle, right? So especially, those, economic related, measures, right? So how to, get the employment going, digitize your services, right? And also the four, synthesized lessons that you just mentioned, agility, coordinated action, etc. Right?
Mm-hmm.
But then, especially the ones related to, public health, right? So the degree of the implementation or execution in a given local market or local city or country will be subject to a few factors, right? For example, the digital infrastructure that you have, right? Or the policy enforcement, right? How serious are you, right? In terms of enforcing those new measures, right? And then also the social acceptance, right? The behaviors of the people, whether they are willing to follow this new model or new rule, which was the fourth that Terry that you mentioned, right? So the degree of the implementation probably will be subject to those three.
Yeah. Would it be fair, Jeongmin, to say that, I mean, the US kind of at a macro level is a highly individualized nation. The people, the culture, the economy, the politics, everything is very, very individualized. Does that make for a very difficult environment, though? You said all this could be done, but is it much more difficult here than it would be in the places Lily talked about in South Korea, in Singapore, et cetera?
Yeah, so it'll be difficult to judge whether it'll be more complex or easier, right? But then I expect that there could be wider variance within the U.S., right? Given the situation will be very different by states and cities.
Good, good, very, very helpful. Chandran, let me move over to you because you have an opportunity to kind of look very broadly at the world, and you're seeing obviously differing outcomes economically. You're seeing differing outcomes with COVID-19. What is your view about why we see such a broad difference, specifically in COVID-19? And then again, we'll get into the transferability of what Jeongmin and Lily highlighted.
Yeah, no, thank you. And I appreciate the invitation to participate. And I also listened carefully to what Jeongmin and Lily said. I'm an engineer by training, a biochemical engineer. So my remarks should be seen in the context that I come from a technical background too. But I've also lived and worked in Asia for the last 30 years, in Hong Kong and therefore China for about 25 years. And I think these examples are very good. So in the limited time to just make some opening remarks, let me say that I think this is typical of conversations we have. We essentially elevate technology to one thing called digital and say it's going to save the world. The examples cited are all good. No one's going to argue against it. But the region, most countries in the world do not have that infrastructure, nor the technology, etc. So this we need to take into consideration. We need to deconstruct this. And the 6 points that were made, I could spend half an hour talking about it, but I'll just make a couple of things here. To the point you asked, Jeongmin, about the US, I would say that the problem in the US is essentially the what I call the exceptionalism that pervades the society. So people can't follow any rules, okay? And then comes to the larger question that you're talking about here. Can the US learn? I'm happy to talk about it later. But I don't think the US is capable of learning from others. We hope this is a turning point. Therefore, it seeks refuge in technological solutions. So an institution like McKinsey will start talking about, and this is nothing personal with Jeongmin or Lily, talk about technology without talking about the social construct. So for instance, China did something that till today the West refuses to acknowledge. It invented something called lockdown, right? It took the world, many parts of the Western world, months to understand that lockdown is not necessarily some authoritarian fascist way of governance. This still is a problem in the United States. Now, when we talk about technology, we should not distill technology down to something digital. And I'm happy to comment for those who are interested too. I did a podcast the other day about this, how this work from home thing has become a sort of an economic apartheid issue. Most people in the world cannot work from home. So we talk about work from home from our little bubbles of people who have the privilege, the white collar privilege of staying at home. So that too is a rather silly discussion that's self-serving around technology. But most people can't work from home. Then the question is, how does society support them? I would argue going forward in Asia, developing world, etc., the most important technologies, if you look at hygiene and all of those issues, and more coming around, are going to be water and sanitation, for instance. We're also going to have to look at how we look at technology, which is not something digital, that essentially starts to curtail the massive ecological impacts of an over-sanitized world. But there was one technology that required the discipline and the ability to think about collective welfare. And that was called the mask. It was nothing to do with a ventilator. It was nothing to do with an app or screening and test kits. Those are all very important, we understand, and Jeongmin explained that. But let's look at Hong Kong, for example, where I live. We have all those technologies, and there's been a bit of failures here and there, like most societies. But the most important thing that affected Hong Kong, and we've not had a lockdown. I've been coming to work every day for the last 5 months since I came back to Hong Kong from Southeast Asia, I think March the 9th, every day. And why? Because the people of Hong Kong understood the social contract. They understood essentially that there is something bigger going on, and they have essentially an obligation, which is the issue of collective welfare taking precedence over individual rights. And this is a discussion that you're still having in the United States and parts of Europe, etc. This is not even a conversation we had here, and most of Asia, and I have some Korean friends, and I'm sure Jeongmin can talk to it better than I can, but absolute discipline, the understanding of the notion of authority. These are all anathema to liberal democracies where exceptionalism, particularly in the US, has taken root in a way that people think they have unfettered freedoms. So you can have all the technologies in the world, which the US has, but it's unable to organize itself. So I think technology, there's absolutely no argument we can have technology, but we should stop talking in the little bubbles of us who understand technology and some of us who are beneficiaries of our relationships with technology. And I think the work from home discussion is the stupidest one going around. Most people can't work from home. Those who grow our food don't grow it at home. Those of us who keep our streets clean don't work from home. Those who keep the sewer systems going and therefore manage the ecological impact don't work from home. So that's, again, how warped the discussion has become. The last point I would like to make is that the issue of how the state operates is something that differentiates Asia from the rest of the world. Absolutely, in my view, right? And I'll take a poor country like Cambodia, where I spend a lot of time, I have good friends, etc. And the cases in Cambodia have been very low. They don't have the advanced technology of Shanghai, nor Hong Kong, but they have managed it. Why? There is a respect for authority. And I'll finish off by giving one more example. Many of you will know that Vietnam has been one of the stellar performers in this regard. They had a spike 2 weeks ago, etc., a couple of deaths, etc. But the inability in our discussions to acknowledge authority forces us to essentially look at other ways of looking at things. And therefore, I'm always intrigued in looking at East and West, how the Western media has played up New Zealand. 5 million people, which would be a mid-sized town in Vietnam, India, Indonesia, or China, isolated, and good luck to them, good luck. But that is not a case study of how the crowded populated world in Asia is living. And in Vietnam, when Da Nang had a spike, I think 2 weeks ago, the government overnight ordered 80,000 people who had visited it for tourism to fly out. And all the Vietnamese got in line and said, yes, we're doing it. And they wore the mask. That's how the technology, the societal needs. And then when you have, things happening where you need to trace, etc. Then, of course, all the technologies that Jeongmin talked about are really important. But in Hong Kong, I can tell you that the key differentiator was the discipline of everyone to essentially wear and use the most simple technology, which was essentially the mask. And so I think more important than technology is how societies exist, the social contract that exists. And it's very interesting and sad, of course, to look at the US, which has all the ability to do everything that Jeongmin said, but it has one deficiency, the inability to act collectively. And then we can talk about leadership and the leadership deficit that is essentially to be seen everywhere, because leadership has been defined through a very, very narrow lens in the US, and I can talk about it. It's typically about power, economic success, and celebrity. And that is a very different way of looking at things.
So Chandran, let me ask you just one follow-on question on this. Obviously, leaders have a set of cards they're dealt. They have an environment that they're operating in that can be political, economic, it can be cultural, et cetera, et cetera. Is your view in this case is that, you know what, US is not going to be able to get success in anything like these areas? Or is your view, it's just got a long ways to go, and here are 2 or 3 things it should be navigating towards on a journey? Where do you come out on that?
Well, certainly no one wants to see the US in decline or in pain as it is. It's not something anyone would like to see. But the honest truth is, I feel it'll take a while, and partly because, including business schools, et cetera, in the US, you have to redefine what leadership looks like. You have to stop celebrating leaders who have traits that in societal terms would not be defined as leadership. And I think in the US, leadership has been distilled into something but so basic about power, wealth, etc. They have been glorified, put into a can of Coke, and marketed around the world. This needs to change. And I would say the fundamental things in the US for leadership learning should be essentially, first, know what you don't know. So knowledge. Second, humility, right? That means getting rid of exceptionalism. And third part of that would be essentially empathy. And all of those things are related. If you don't understand the world, you cannot speak from a context of knowledge, and you're only talking about the US experience. And I go to the US quite often, etc. And I'm always stunned by how parochial so-called global leaders are. But they are compelled to speak in terms that essentially promote exceptionalism, because that is what they are expected to do. And you see it on TV shows, etc. There's very little display of humility, and you have to have humility. And I think that's the journey that hopefully this pandemic will start in the US. So in short.
Excellent, very helpful, very helpful. Dr. Kim-Farley, you're going to be in the fortunate position of trying to answer the question here. You got very differing views here. So one side, you hear a lot of things about the prospect of technology and economic growth. You also have a view that says, you know what, there are some fundamental, deep-rooted reasons why the US is not well positioned to improve. What is your view on all of this?
Well, thank you. Firstly, also on behalf of the Fielding School of Public Health, I really wanted to express appreciation for the partnership and working together on the COVID-19 with the Centers at Anderson. Also wanted to mention especially Jeongmin and Lily and their colleagues for that excellent paper on how technology is safeguarding health and livelihoods in Asia. And certainly for those in the audience, I really do recommend that they not to read this and get even more insights. Well, I think in terms of, again, the 35,000-foot view, obviously technology is not the sole answer. And at the same time, we have to put into it the cultural context in which we are. And I think that in the United States, that often is a complex matter. And I thought maybe I'd first just kind of mention using the framework that Jeongmin and Lily have put in about this technology, the implement a watertight track, trace, test, quarantine cycle. Again, the tracking mechanisms, like was mentioned in South Korea, is extremely robust. It was done also in China. And here all we have is some voluntary apps at the moment with Google and Apple that you have to download, and you have to give a permission from your to your local health authority, that then if you got COVID, they could go ahead and have it so that you can alert contacts, and also you can expose someone that if they've gotten on their downloaded app, you'd hear about it. But it's obviously a very weak system. I think that really, though, we probably in the United States don't have that much appetite for a really robust tracking mechanism, maybe followed up with mandatory isolations and mandatory quarantines. I think had the COVID-19 had a 10% or 20% death rate, that might be different. So I think, again, there's some context in that as well. And bottom line, what we're really having the problem is testing, just getting the testing, much less worrying about the tracking, because our testing is oftentimes lacking and not timely. So that's one thing we're having to work on at a leadership level. I think in terms of leveraging technology on resources to enable surges in healthcare capacity, the one thing that we probably have adapted and adopted here a bit in the US is the telemedicine with Medicare and Medicaid, allowing those also as, and private insurance companies allowing those contacts. And I think that has been something that has helped a little bit. I think one of the real failures perhaps on our side has been to communicate transparent and timely information to the public. Very highly variable within the United States, including at highest levels of government, the lack of a consistent message and also emulating that message. For example, demonstrating mask use, I think has led to confusion in the public. I think we also need to make sure that we are informing the public of what to expect in a changing scientific world with a new virus. That, for example, something that has been suggested early on, like not wearing masks unless you have disease and you're going off to the doctor's office, to then, because we recognize the problem of asymptomatic spread, to having everyone should be wearing a mask because you're really doing it to protect other people. And if everybody does it, then you're protecting yourself, cause confusion. And I think that we need to, again, made people understand that things will be changing over time in terms of what guidance you'll be receiving, and we're all working together on the same team on this. I think go all in on digitalizing products and services. Certainly e-commerce has taken off even more so here in the United States during this. A lot of delivery services, grocery stores, restaurants, things like this. This embracing work from home to maintain economic activity. I think that Chandran pointed out a good point that for employees who can work from home, yes, there's been a shift to teleworking, but unfortunately, many essential service workers, farming, food processing, garment workers, still need to be physically working at the location, often with inadequate physical distancing measures, or in crowded living conditions like migrant farm workers, so that they're going back and living very closely together, and so that anybody who gets it is quickly spreading to others in that living environment. And sixthly, the effectively safeguarding and redeploying labor. I think in the United States, rather than really being an active engagement of such redeployment, there's been a kind of a market-oriented approach where people that are out of jobs are trying to seek employment from anyone who is hiring, like delivery services, or they're relying on the Paycheck Protection Plan through their current employer, or they're receiving unemployment benefits, or and in many cases where they're falling through the social safety net crack, they're drawing down and exhausting any savings that they may have had.
Yep, makes sense. Dr. Kim-Farley, let me ask you one other question, and then I'm going to go to everybody to try and understand what is in the art of the possible for the US. But Dr. Kim-Farley, let me start out with you. One of the Stanford professors, Dr. Fukuyama, who's a political scientist at Stanford, was posed a question recently on CNN about why is the US have such a big problem with COVID-19? And he highlighted two things. He basically said, number one, there's a basic mistrust of government in the US that dates back to the formation of the country in the Revolutionary War, that said that government isn't always doing good things and you need to kind of hold them at bay and let the power of the individual kind of carry on. The second thing is a concern. He said that everything has become politicized. Any major national issue in the US here has become politicized, which makes it even more difficult for a government to be effective. Do you buy that? Do you accept that that's one of the big detriments, big limiters we have here?
Well, certainly there are those who have distrust of government. There's no question. We've got, as you say, going back to the Civil War, but you also have such practices more recently, Tuskegee study that affected Black communities. I think, though, however, even if you have proper and consistent messaging and you had transparency and a perceived threat, the population can respond to government. And I think that New York is a good example of that. Really, again, they got hit early on, but, bore the brunt of the pandemic in the beginning, a rapid increase, but everybody rallied around and you had a rapid decrease, and they have maintained that. I think that in one sense, like in California, we haven't seen some of the rigor of people using masks and things like this, and mask resistance groups, et cetera. You don't see that to this degree in New York, because people experienced loved ones, family members, friends, dying from this disease. So in a sense, they understood the importance. So I think also you have a sense that I think that the 1%, infection to mortality rate, often we talk about case fatality rates, but to bring a little epidemiology here from the School of Public Health, you also have what we call the infection to mortality rate. So rather than deaths at the top of the numerator and known cases as the denominator, which is the case fatality rate, the infection mortality rate also includes all of those people who have asymptomatic disease and are not known cases. So that's a much lower number. So it's been estimated somewhere between 0.26 to 1% is the true infection to mortality rate. Now, say 1%. Had that been 10 times less, 0.1%, like down at the levels of seasonal influenza, there just wouldn't have been that much concern, even in public health. We'd be watching it very closely. Obviously, new virus, we don't know how it's going to behave. But there wouldn't have been the anxieties. If it had been 10 times more, at 10%, say like SARS, everybody would have been turning to government public health. What can we do more? What can we learn? What can we, from other countries, let's get all of our masks on. You would have seen a much different situation. So I think, unfortunately, or fortunately, if you look at it from the point of view of how many people are dying, the 1% is at a level where people, some are looking, well, look, all this curtailment of economic activity, I'm out of a job, et cetera. This is much worse than the numbers that are dying. And others are saying, well, look, every life is precious, which is true, and we need to do everything to save every life. So you end up with this polarization, and to compound it, you have a age distribution situation going on, such that those who are younger are really at much lower risks of severe disease or dying, and therefore it's well, why are we curtailing our activities or our livelihoods? Why don't you just protect those who are elderly and in nursing homes, which unfortunately we did not do a good job of.
Good. Chandran, let me go back to you and just ask on Dr. Kim-Farley's comment that, the U.S. is not a monolithic place. It's a very diverse place. And you look at places like New York that had a terrible incidence, and they've improved much more. And I assume, Dr. Kim-Farley, they almost would look like Europe in our views, where they had a bad case and then everything started to get a lot better. Chandran, is your view that, yeah, there are plenty of opportunities to have some great things happen in the U.S., and there are plenty of resources, telemedicine is advanced, and e-commerce, et cetera. What's your view on all that? Do you see the promise there and believe in it, or this is more broad-based and widespread than we're talking about?
I just had a message from a friend of mine in the U.S. From New Jersey. He's a Black American, and he said everything we're doing now is too little, too late. He said our strategies are so wacko that even the virus doesn't know what we're doing. So it's mutating. So that's a bit tongue-in-cheek. But the point I'm trying to say, I mean, really, I'll reiterate what I said. One really hopes the U.S. will get to grips with it. But I don't see how it can at the moment. It's going to be painful, but it's going to take, and I'm not going to mince my words, there is no shortcut. It requires draconian measures. There is no shortcut. Large populations, urban centers, etc. And the point is that every country is complex. To suggest that the US is different from other countries, that too, in a way, is a cop-out. We are different. Well, every country is different. And so I think the US leadership has to understand, and New York, you said, is a good example, but even people like us had to bear watching the mayor of New York come on TV because CNN were trying to tell us what was going on in New York every night. He did an incredible job, a bit painful, but to listen to, but he committed to communicating all the time. All the other leaders I see are just fighting with each other, a governor suing the mayor and all of that. So there's no collective governance systems. So I would say, my view is draconian measures, and perhaps I'll be cheeky and say, follow the Chinese model. There's something called lockdown, which was invented in China about 6-7 months ago, and now has become accepted in the world. But the world refuses to accept that something right happened, and it was in a country called China, right? So that's the first thing. There are no shortcuts. It's got to be draconian. And the trap is to seek to deflect from the societal breakdown, which requires essentially cohesion, authority. You've got an existential threat. There is no shortcut out of this. And then to divert it to some discussion about where complex societies, etc., and their technological solutions. I don't think this will work. So I would like to see the US essentially start to accept that it has an existential threat, but I'm not sure that, and your politics clearly is way off course, but that's not for me to comment here. I don't know how you get through this over the next few years. And my view is, coming back to the Fukuyama comment as well that you made, I think he leaves out a couple of things that are very important here. Yes, the inability to learn from others is rooted in exceptionalism. It's rooted in structural racism, that others are not the same as us. So it's not just a Black Lives Matter issue. It's an issue that we can't learn from these other people. We can't learn from Chinese. We can't learn from Vietnamese. So that's a problem too. A private sector that is essentially driven by self-interest and essentially the outsourcing of public and private good to the private sector. And I remember the mayor of New York giving some stats about the number of hospitals in New York that were in private hands. And I was horrified that so many hospitals, such a large percentage, were in private hands. Once you do that, essentially you create an economic divide. People can't afford it. So it's a whole sort of structural economic basis. And finally, I'd say a lack of appreciation of the value of collective welfare, and that the individual is king, which is rooted in the psyche of the American. So I've got American colleagues here, and they say, you can't believe it. People go around saying, I have my freedoms, I don't have to do anything to wear a mask. This is unheard of in other societies. So that sort of lack of appreciation. And finally, I think racial and economic class war, which we've already talked about, which has essentially created this sort of, the impact on the Black community, the Hispanics, etc. And lastly, I would say, we know that certain people have been predisposed to the virus, and usually they have pre-existing conditions. And one of the things that is not talked about is you have to reform the whole issue of the food people consume. There's a huge segment of the adult population, I think it's 50% the last time I heard, who are obese, not overweight. They are all susceptible to these sorts of health crises. And there needs to be a discussion about completely revamping the food system, irrespective of how you intervene. And therefore, you have to require a strong state that's able to intervene in what is not good for public health, because this will not be the last shock. Yep. And so I'll come back to, without a strong government, I think you are going to continue to run into these problems if they come back in one form or other.
Good, good, very helpful. Let me ask one last question to each of you before we go to audience Q&A, because we've got a lot of Q&A. And it's a broad question here. In leadership, obviously, leaders have to understand context when they devise their strategy. They have to think about the local environment that they're in. They have to think about what are the controllable items, what are the things they can affect versus things that technically are just uncontrollable. And I want to ask each of you, and I want to start with Jeongmin and Lily, and then Chandran, and then finally Dr. Kim-Farley. On a scale of 1 to 10, 10 being a great outcome on COVID-19, effectively diagnosing, dealing with the issue, minimizing economic impact, all the good outcomes that you think are absolutely in the art of great outcomes. 1 being self-inflicted, terrible outcome, loss of life, bad economic outcomes, et cetera, et cetera. Tell me where you think is in the art of the possible for the US to get, knowing the context, knowing how things operate, et cetera, et cetera. Where is the US right now, and where can and should it get to? Jeongmin and Lily, let me go to you on that.
Yeah, so it'll be difficult for us to quantitatively assign score for this, but I this is a difficult question, so I let Chandran and Dr. Kim-Farley react to this, but I also would like to share some thoughts, right? So Chandran mentioned that, hey, the US may need to follow the China, model, etc. But then there are also, observations from other countries as well in Asia, right? So, for example, Korea, right? So there was no lockdown in Korea, and the economy is recovering fast. And I think, we can also draw some general leadership lessons out of that, right? So, for example, speed of decision making matters, right? And that is very important to policymakers as well. The reason there was an early containment in Korea was because there was an emergency approval process of the testing kit, right? Very, very early on in January, and they were able to export it, right? And then second is about embracing trial and error. So there was a innovation around drive-through, walk-through, that kind of practices. That was initially done by local government and then later on scaled up. Right? So, that kind of, spirit of encouraging more innovation, right, will be critical for the policymakers in other parts of the world. And the third is the ability to, coordinate different units of the economy, right? So, for example, the track and tracing time, it used to take days, and later on it became just 10 minutes because, they were able to coordinate 27 different departments. Including payment company, telco company, etc. Right? So as a government and policymaker, how do you coordinate those different institutions? That's also very important capabilities. And those are additional lessons we can take away from Asia.
Good, very helpful. Lily, anything to add to that?
I'll add a little bit. So I'll talk about government side and also talk about the business, the private sector side. So on government side, I feel like now there's this expansion of role from just, protecting citizens to also supplying services to ensure that businesses, especially those small and medium-sized enterprises, could continue to operate. So the QR code in China, and also I think Singapore also has a similar system called Safe Entry for people to scan QR code to enter restaurants. And that's also to ensure that those small, medium-sized enterprises could continue to operate. And then on the business side, I think 3 key questions is, how do I protect my employees? How do I protect my customers? And how do I help the broader community? So as Chandran rightly said, there are many jobs that you can't do work from home for those jobs, a lot of the manufacturing jobs and all that. And there are manufacturing companies that start to produce masks for their own employees. There's this one really big electronics company that I think at peak produces 2 million masks per day so that they can have 2-week mask supply for all of their employees at all times. So there are things that, based on the business situation that businesses can think about to protect employees, customers, and also the broader community.
Mm-hmm. Excellent. And I assume from both of you, I just wrote a note here, politics doesn't equal culture. And so basically what you're saying is, we may say we disagree, we have a different political system than China, but there are plenty of other nations in Asia that have a more similar political system to the US and still have been able to deal with this issue, primarily due to culture. Is that a fair summary of what you said?
Yeah, so every country will be different, right? But then I think that the leadership lessons, right, so can be distilled, right, from various countries, and then they can be relevant in the context of the US as well.
Excellent. Chandran, your thoughts on this? And if
I
you
think,
want to give a score 1 to 10, you can do that as well.
I think the US is somewhere around 2.
Okay.
And we hope we can get to, I mean, no country is going to get close to 10 because we haven't seen this run through. And we'd like to see, I think if most countries get to 6 or 7, we've all done really well. And, it saddens me to see that. But I will say that although we have different political systems and the Chinese system is very different from the US, let's also be very honest. The US system is a freak show. It's so different from anybody else. So yes, Korea is a democracy, but it has a very different political ethos operating within that. It's not as toxic, etc. Right? So that is a requirement of what I call a healthy democracy. We have different parties, but when push comes to shove, people come together. And I'm not. I have a few Korean friends, and I know, and Jeongmin will know. But to have the Korean mindset or the Japanese mindset, that you can't find that everywhere in the world. Those who know who live in Asia know what I mean. That's a very different discipline. And in the early days, the Korean private sector just jumped in. They didn't need any regulation, any laws. They didn't think about shareholder value. They just went and did stuff, right? Similarly in Japan, etc. So that's important. But then we have countries that are sort of middling in Asia. I come from Malaysia. So when this started happening, I thought, oh my God, my country, lovely place, but everyone's lacking in discipline. We got a political system that's a complete mess. But thank God we had a very good director of health, a director general. And somehow all the politicians followed him. But what was more important is the people, and they don't have all the technology that a Korea has or Shanghai has, all the rural areas where a lot of people live in small towns, etc. The internet's not that strong, but a strong leadership and the politicians who typically misbehave fell in line because there was this view that we are all in this together and we have to stop squabbling. And people did not tolerate this kind of squabbling as well. So everyone came together. And I think Malaysia is ranked fairly high. As a Malaysian, I had no view, I was very skeptical that it would do well. So the point that I think Jeongmin makes is an important one about how the societies are governed. But the politics and the culture, I would say, are not completely separate. Your politics also influence your culture, and the culture influences the politics. And the politicians in Korea know if they misbehave, I think the Korean people are going to come and get them, right? So that too is what I think is an important differentiation in the culture in Asia particularly. And I should not forget to mention Africa. And I was seeing the other day a really interesting story for those of you who are interested. There is a risk the numbers may go up, but they're still relatively small. We will see third wave, fourth wave. But go and look at the story of Rwanda. A country that suffered genocide 25, 30 years ago. And today is the cutting edge using technology, but that technology wouldn't work if it didn't have and had cultivated a culture of absolute discipline. And the society had been transformed because it believed in the authority of the president and the institutions. And yet, Rwanda, being successful as a small African nation, is typically criticized in Western liberal media. But President Kagame has been steadfast. And anyone's interested, go and check out what a small country in Africa is doing with the ability to control and have instilled a collective notion of community across the country, and then using the technologies that Jeongmin talked about to curtail this. And that's a success story. So you need both. And politics is culture and culture is politics, in my view.
Good. Dr. Kim-Farley, you've heard all the comments here. And again, scale of 1 to 10, if you'd like to score. What is your view on all this?
Thanks, Terry. Well, I am taking up your challenge on the score. So I'm giving us a 2 at the start. I'm giving us a 4 or 5 right now, and that we have to get to at least a 7 which is where I think New York is to be able to handle it here. One thing I wanted to mention is that my wife actually is a master's in public health as well. We've been thinking about this, and we think that this issue of that there's really three protagonists that are involved in this: government, businesses and schools, and individuals, and that each has a role to play in this. So government needs to be, being able to monitor, making sure there's coordination of supplies, being able to put out the guidelines that are necessary and the criteria. Businesses and schools have to be at their level, making sure that they're implementing the things for physical distancing within their, like a restaurant spaced out, or people waiting outside or spaced out 6 feet distance, that sort of thing. And then as individuals, practicing the mask use and things like this. So that I don't think the pandemic is really going to be possible to control unless you have these three protagonists each playing together and working together. I mean, admittedly, this is not an existential threat. As I talked about, the 1% infection and mortality ratio is not going to wipe mankind off the earth. We had much worse for the Spanish influenza, and we did survive as a human race. So we're not existential threat due to this, but it certainly can cause a lot of pain and needless suffering, disability, and death. I think in terms of some of the learnings that we need to, again, leaders need to listen and work in partnership with public health experts at national, state, and local levels. Again, this has been mentioned, the rise above partisan politics. When essential public health measures like mask wearing become a political issue, it creates such a division. And again, we will not be effective. The three protagonists will not be able to work together. I think also we've squandered such an opportunity. I think it hopefully is not totally lost, but we shall see. This could have been such an opportunity to create a stronger unity within this country and in the world. I mean, after all, we are all fighting a common enemy. By pooling resources, wealthier countries supporting developing countries, strengthening, not weakening the World Health Organization. Admittedly, it has its own flaws, as any country has its own flaws too in international organizations, but it certainly has the mandate to try to coordinate globally, and we need to be strengthening it, not weakening it. I think we also now to recognize that at this point, the actions that we do, for example, developing and producing a new vaccine, we have to recognize these things become global goods, that we need to make sure that there are mechanisms to ensure that vaccines are not just for wealthy countries that kind of gobble up the limited supplies, but that actually it's available to developing countries as well. We as a social justice issue, which is a key concept in public health. And I think that in a sense, the whole world is in this storm of COVID-19, but we're not all in the same boat. We need to be looking out for the downtrodden, and in a sense, that's an espoused American value. It's just not being practiced to what we'd like to see. I think of it as if you think about the world as a human body, if you had a situation of like the brain and it's got a festering wound in the foot, the brain doesn't say, well, I don't have to worry about the foot, that's its problem. No, that festering wound could become septicemic. You can end up infecting the whole body, and the whole body dies, brain and all. I think the same thing happens in the global community. We recognize that we are in an interdependent world, and whatever happens can affect us here. And really, the pandemic itself will never be truly controlled anywhere, and really, unless it's controlled everywhere.
Mm-hmm. Excellent. Dr. Kim-Farley, let me ask you one. Maybe it's a more personal question, but our kind of attitudes and emotional state as leaders often drive us to do things or not do things. Mm-hmm. When you go home at the end of the evening and you look at the loss of life, the number of cases, you look at it on a comparative basis, when you go home at night, do you say, shame on us? This is a complete, unnecessary, wasted outcome? Or do you say, you know what, yes, I could go there, but you know what, the context is different. We have a whole bunch of other great things that are offsetting items that we'll do a webinar on all the good things. And this is all kind of, we have to just live with it, but don't get carried away on your disappointment. What is your emotional state on all this?
I think in a sense that I think there have been many missed opportunities. I think that there have been many challenges that we've not really risen to our higher selves to be able to do. I still am always an internal optimist. that we can come together at some time here and to achieve this. But it's something that I think is important to recognize, that it isn't just the technology, it isn't just the systems of governance. It really is people's hearts and wanting to work together, having those things of cultural humility, working with empathy, I think was mentioned. And I think those are the things that we have to recognize, that we all have to do things for protecting others. It's not just me only.
Excellent. Let me start asking a bunch of questions. We've got a lot of questions from the audience. First one's from Prince, one of my former terrific students, Suresh, another one. And they're oriented around data policy, data privacy views. So one of them is, how can nations establish a consistent global approach to collecting and sharing data so that we're all benefiting out of this? Another one is, how do you address data privacy concerns, and especially in the US and in Europe, which tend to have very strong data privacy laws. Dr. Kim-Farley, I want to start with you.
Yeah, I think in terms of global sharing of data, I think it's really important that that be done. I think one of the biggest problems we have right now too is that, again, lack of testing and things like this. So even if the data is shared, it's so far from what the reality may be. That's a big problem that we just need to continue to be working on and helping countries work on that. And I think that this data privacy is going to vary country by country and what is culturally acceptable to do. But I think that we all have to recognize we may have to give up some of our privacies to be able to protect others, and by that it ends up ultimately protecting ourselves, because the faster we can stop this pandemic, the quicker we also are no longer at risk.
Good, excellent. Jeongmin and Lily, any upgrades on that?
Yeah, so in terms of the data governance, digital governance, unfortunately there's no global consensus, right? So that is even before the COVID, right? So every country has different philosophies, so-called digital sovereignty, etc. So on this one, there needs to be continued discussion around the world, and then each country needs to contribute what they know and from their practices as well. But then in case of emergencies, there are also some actions that some of the governments took, overriding the existing framework. For example, in Korea, there was a so-called Personal Information Protection Act that was enacted back in 2011 or 12. But then during the COVID, they just override that law in order to make sure that there is a very rapid tracking and tracing. And also, in case of China, right? I think also what Dr. Kim-Farley mentioned was very important, something around the partnership, right? So everyone needs to contribute, right? So in order to gain the trust of the individuals in terms of sharing the data, the government and businesses, they need to show their commitment, right? So in terms of protecting the data, right? So that's how the people in some of the Asian countries, they were willing to press the consent button, right? In terms of that the tracking and tracing measure, and then there needs to be practical benefit by doing so, right? So when I do this, when everyone else does it, and there is a critical mass using it, then I get much more accurate information that can protect my safety and my family's safety. So there needs to be that kind of partnership and trust across multiple stakeholders.
Good, good, very helpful. Chandran, let me go to you, and I'm gonna hopefully see at the end of this, you'll have even more faith in the US here, because one of our students is asking here, one of my former exec MBAs, what could each of us as professionals, technologists, and leaders be doing to get past US exceptionalism and leadership failures?
Yeah, that's a good question. I mean, just a quick point about the data side. I think it comes back to a culture of collective welfare. In many Asian countries, as Jeongmin would probably agree, people are not obsessed about privacy as they are in Europe and the US. They're not. So, but so this culture as well. So to this issue about exceptionalism, etc. I always am puzzled when I speak in the US how defensive people are. Even when I come to academic institutions, I usually don't speak at forums. I don't get invited by Republicans, but I get kind of invited by the Oprah crowd, you know what I mean? The supposedly liberals. But the moment you start being more intellectually robust and honest, Americans retreat because they think you can't tell them something. So to that, a quick answer to that question, and I didn't mention it earlier, I think the essence to leadership is firstly intellectual honesty. And we talked about data and science. And so you've seen in the US for a while, depending on the political camps, a denial of the science, whether it's climate change or now this. But I also see this in institutions of learning, sadly. Business schools that don't discuss issues like the price of consumption and therefore how do you have to change business models, etc. Technology firms that essentially don't talk about the externalities of essentially their business models, which are free ride on externalities. I could go into all of that, all the delivery apps, etc., the social costs, the environmental resource costs, etc., not to mention that. So I think in the US, and maybe this is the challenge to the business school, starting with UCLA Anderson, I think you have to be teaching essentially intellectual honesty. And that means let the data and science drive management teaching. And this is essentially, in my experience, and I've been with a lot of American business schools, etc., conveniently swept under the carpet, because that then essentially puts you offside in the transactional nature of essentially American society. A business school is a business rather than a school. And a school needs to be intellectually robust. And we live, if you don't think climate change is an existential threat, then you're in denial. And then you need to understand what's the root cause of climate change. It's consumption. And there was one US president who actually was intellectually honest and did try, long time, and he was ahead of his time, so it was Jimmy Carter, who talked about our economic model is broken. He was way ahead of his time. And he talked about the need to essentially reframe the economy away from the promotion of relentless consumption. Now, business schools that are essentially business orientated for a start, if you're to get over this, need to just promote exceptionalism, need to be more honest. That's the starting point. And the honesty starts with also being humble and saying, I think we got this wrong. We've been preaching all of this for 50 years. It's wrong. Let's dissect it. And that's really what it is. And maybe UCLA has started by inviting someone like me to come in, just shoot the breeze here. But that's where it starts, I think.
Good, good. Dr. Kim-Farley, let me ask you a question here, and there's a couple of them kind of in US actions here. What societal tools or government programs and policies are needed in the US to better incentivize people to collectively abide by COVID protocols?
So I think the situation has to be that we recognize that we have some success stories in the United States, let's say in New York, that we can do it. And that we need to see that, all right, look, we have to recognize that, again, not exceptionalism on the individual side either. I can go ahead and have my parties, or I can, go crowd the beach. No, that's the types of things that are driving this. And so I think also the pain that we are seeing with the economy and people out of jobs, that's also going to force, and now children not being able to go to school, that's going to force stronger realizations too. Look, we want this over. I'm sure everybody wanted it over 3 months ago, but what do we really need to do to get this over? And that's going to be then these basic fundamental issues of wearing a mask, physically distancing. We can still do our business, have our food in restaurants and things like this. It's just a matter of practicing these measures that can bring this R0, which is, the reproductive rate, down below 1, so that the numbers of cases are dropping, not increasing.
Good, good, very helpful. Jeongmin and Lily, a couple of questions here on benchmarking of other nations here. So one question, Thomas Kim, one of my former students, how have Asian countries restored faith in their ability to handle pandemics and reform the social contract after missteps with earlier outbreaks such as SARS?
Yeah, so, so first of all, there's a big variance within Asia, right? So some countries, have done, good early containment, others have not, right? So, we shouldn't also think that Asia in a, monolithic, region.
Mhm.
And then second, it depends on how you look at the historical, cases, right? If you look at, if you look at China and Korea, those two countries, showed some, relatively faster, so-called, flattening the curve, right? So the containment of the virus, and that was because, China had an experience of SARS, Korea had an experience of MERS, right? So and because of that, they were able to, build a system and protocols and processes to deal with those emergency cases. So, right, so then the takeaway, for the other countries will be, hey, learn from the historical lessons and then, apply that. I think also Dr. Kim-Farley mentioned a very good point. We need to implement it, right? We need to practice it, right? Practice the lessons learned.
Mm-hmm. Excellent. Let me, I'm sorry, Lily, do you have anything, or that covers it?
I'll just add a little bit. I think those experiences with SARS and MERS in Asia, especially in China and Korea, definitely added to kind of the effective response in the mass population, because people had memory about that, and they see this, new COVID-19 virus and think about the same coronavirus before. And just kind of adding to what Jeongmin said about taking these lessons forward and building that muscle to respond to these crises. So how to form a plan ahead team for those crises going forward, and how to enable fast responses in situation like this. That's what I think both government and businesses could think about going forward.
Good. And Lily, on that topic, let me ask you and Jeongmin as well. There's questions about benchmarking of nations. So one of the questions from Brian is, do you think if the US had modeled behavior of countries with examples from countries like New Zealand, would it have saved more lives? Is New Zealand the best benchmark based on all the countries you've worked with? Would you call out South Korea? Would you call out some other? What country would be a good benchmark based on everything here?
That seems hard to respond. Let me try. So I think we kind of, if we look at the spectrum of measures, there's China, which is super strict, and then there's countries like Korea and Singapore that kind of more open with the borders and let people in and do things like a lot of testing or contact tracing to tackle those pandemic. And it depends on, what the population is comfortable with. If the US population is not comfortable with more draconian, the lockdowns and all that, then they could look at measures of these other Asian countries for benchmarking.
Excellent.
Terry, could I jump in there, Terry, one second? Because I think, China is a very large country, and I think Lily will know better than I do, but I have friends spread around China. Not all of China was affected, but China instituted a large discipline lockdown in different places. I have friends who live in remote parts, small towns in Gansu province, but even before the dictate, everyone just got the message and people disciplined. But with regard to SARS, etc., and I'll just give you the Hong Kong experience. So when we talk about a benchmark, I don't want to take any credit away from the New Zealanders, but you have to see the context. New Zealand is isolated, so far away. It's 5 million people dispersed around, a large mass of land. But look at Hong Kong, and I think, I'm not batting for Hong Kong, but we didn't have a lockdown. But the main lesson learned in Hong Kong was SARS, because during SARS, Hong Kong people were absolutely paranoid, and this was 13 years ago, or something like that. And so in January, when I was traveling back and forth, Hong Kong people were already wearing masks. And I was still in the mode, I don't need to wear a mask. But in January, they were wearing masks. And you had queues around pharmacies, etc. At 7 a.m., people buying masks and toilet papers, which is not a good sign of some social behaviors. But people understood And then the last point I want to make is, as you all know, we've had all these upheavals, political upheavals in Hong Kong most of last year. But in January, immediately people fell in line because they learned from the past, they have an understanding of collective welfare, and they understood the importance of following the administrative instructions of the state. Although they mistrusted the state for whatever reasons on the politics, they completely trusted the ability of the institutions of the state to deliver on the order. And that's my last point. The state, therefore, is not simply the institutions, it's the relationship and the trust that Jeongmin mentioned between society, etc. And when that trust is broken, which is what I see in the United States in the divisive politics, then the state can't operate because there is no mechanism. In Hong Kong, people understood from the past, wore their masks, the state provided guidance, and we continued to function. And I think in a way, for me, that is the benchmark of, around Asia. And to remind people, 8 million people in the most congested part of the world, very different from New Zealand. Very different. So 8 million people. And that's the context. If you have that density, you have to have the social contract and understanding of the authority of the institutions.
Yep, good, good. Dr. Kim-Farley, there's a couple questions here for you. One is from Angela, who's at our medical school. Do you believe the US focus on democracy can be too slow to employ the agility at scale of other Asian countries regarding COVID? That's the first question.
Thanks, Angela. I think that the reality is, I mean, we are a democracy. That is our institution of governance, but it doesn't mean that we can't be united. Again, looking at public health professionals, what is the advice being given, having our government at all levels, national, state, and local, being in sync, same message, same criteria being used. Doesn't have to be necessarily the same degree of application of the control measures everywhere in the country. It's a vast country, but everybody understands the criteria of when they are instituted. And then, you know, again, willingly follow those for their own self-interest, just because of the fact that they know that if everybody does follow it, they will themselves be safer and can get back to work, kids to school, etc.
Excellent, excellent. Another question for you, Dr. Kim-Farley. Presidential candidate Biden says that he plans a national mandate for masks. How do you wake America up to the collective benefit of honoring the social contract here?
Yeah, I think that, again, it's going to be a situation where I think there should be a national mandate for masks wherever there is COVID transmission going on. Again, there may be places that there isn't COVID transmission. But I think, again, that's where you need to have, I've heard it recently, we talk about precision medicine. Recently read an article on precision public health. You know, we need to be targeted as to what we are instituting by locality, appropriate to the conditions in that locality.
Excellent. Good, good. Let me ask a final question of each of you, and then I want to do a summary here. If you were to fast forward a year from now and 10 years from now, and say, where are we going to be on COVID-19? Where are we going to be on learnings? How will our attitudes about all the enablers be? Where do you think the US will be a year from now and 10 years from now? Jeongmin and Lily?
Yeah, so it'll be, you know, so, you know, difficult, you know, we all of us don't have a crystal ball, right? But then, you know, our view is that, you know, human race, you know, has been overcoming those, you know, challenges, right? So therefore, probably we'll have vaccines and so on, right? But then also there is a big debate on the new normal and next normal. You know, our view is that, you know, a lot of the so-called next normal or new normal will not be completely new. It'll be an acceleration of existing trend, right? So, you know, digitization being one of them, right? And then also the increasing, you know, inequality, right? If we don't, you know, properly intervene, right? Increasing inequality at the corporate level as well as individual level, right? And then also changing consumer behavior, right? As well, right? And then also, you know, the role of, you know, state versus, you know, private, right? So, you know, that kind of debates and discussions will continue, and then will get accelerated by the COVID-19. So yeah, so, you know, 10 years from the now, right? From now, right? So it may not be a fundamentally different future that we haven't thought about, but then, the fast forwarded, accelerated future that of the existing trend that we see.
Yep. And Jeongmin, let me ask you one follow-on on the question. 10 years from now, will the US have had such a great set of learnings that it will be on another path to be able to effectively deal with the next pandemic or climate change or other areas of innovation required, whatever it is? Will the US be on that path, or you know what? This is the beginning of a decline, an admission of failure without the ability to kind of grab hold of it and say, we're going to get better out of this. Your view on that?
I don't have a view, but then, I hope, right? So US, make a good progress on those, right? In terms of overcoming this humanitarian challenge and pushing more, frontier innovation. And also China, Korea, Europe, many other countries, right? So we, we can, generate a, can lead to a better world, right? Out of this, crisis and lessons, so that, everyone can win and benefit. And this is a collective challenge, right? So this is a humanitarian challenge. This is not about, US versus other countries, etc.
Good, very good to hear. Lily, your thoughts?
Yeah, I'm hopeful that 10 years from now, I do agree that decision making will be faster, and I think people's expectation for how fast things happen, it's already accelerating, and I think it will continue to be so. So I'm hopeful that good things can happen even faster.
Excellent, good. Chandran?
I suppose 10 years from now, it really depends what Americans learn from this moment. What this moment looks like, we'll only be able to tell perhaps in a year, because it's got time to still play out. But then you said, is it about the US in decline? It depends what you mean by decline. Too many people see the US changing as decline. But the US needs to change. And you can't talk about the next year, the next 10 years, without calling out the elephant in the room, the current geopolitical tension between the US and China. I live in Hong Kong, and we're a pawn in that game. The aggressive nature of US foreign policy, I hope, changes. I hope China will rise peacefully as it has promised to do. That will define how the US works. But decline is perhaps not the right word to use. The US must change. I think all Americans need to accept this. But if they stand by, we are the light on the hill and all of that nonsense, then we will continue to see tensions geopolitically, and the US will not be able to change. So I think it's incumbent on schools to essentially change the narrative, change the way you teach what the US role in the world is. It is not that indispensable nation. All nations are important. But this narrative is so ingrained in the US, even amongst liberals. So that I hope will change. It will not be decline, and the US will be one amongst equals in the world and not see itself as separate from others. And very importantly, I think at the geopolitical level, which it's at the core of this problem, is also the way the US is now started to use finance and the weaponization of finance to essentially further its dominance. And we've seen some of that already taking place during the COVID. And Dr. Kim-Farley talked about the global good of vaccines. We'll see what happens with that too, because we've already seen that countries have signed up, but essentially starting to buy. And depending on what happens in November, we'll see how exceptional the Americans are in terms of essentially buying it for themselves, because they still think they are number one. That is not decline if it changes. I think that's a very good thing for the Americans, but it starts with humility. Please teach it in the schools.
Good. Thank you. Dr. Kim-Farley?
Yeah, so I think in a year's time, we are going to be seeing, vaccines, therapeutics, improvements, et cetera. So I think we certainly will have flattened the curve and are on the downswing. 10 years from now, I think we'll probably still see worldwide some smoldering COVID going on, and that, it'll be like, in a sense, you have a matchbox, you're striking matches, throwing it at the forest, and having little flare-ups from time to time. So I think that will happen. I think we need to really develop a humble posture of learning here in the United States to be able to make lessons learned and put them into reality here. I think there's something else though. In 10 years, I think we will be, lesson learned about stockpiling. But we did this after 9/11, and those stockpiles dwindled or were left in California. We sold them off or gave them away because we couldn't afford the $5.8 million a year to continue to maintain them, to be able to have the ventilators started up and working and all of those things. I think also learned about a public-private partnership that's occurred, with testing. This was done very well in Korea, where they were already geared up, ready to go, so that they came up very quickly with that. So I worry more about maybe almost 30 years from now, just like we forgot after 9/11 for the stockpiling, whether, a generation or two down the line, we'll forget about COVID-19 and people say, well, why are we spending money on these, supplies that are just sitting around? And we'll go back to some complacency.
It's good. Listen, let me share. I always like at the end of these to share my own takeaways from this. And I have to say, of all the events that I've hosted, this has probably been the most broad and deep set of discussions we've had on politics, on economics, on national issues, on global issues, et cetera. So I found it very, very helpful. It also makes summarizing very difficult because of the range of views. But let me take a shot at doing that. The first takeaway, and I've got 4 takeaways here. First of all, is this idea that Dr. Kim-Farley raised about the protagonists, that governments, businesses, and individuals are all protagonists here, that all have a very critical role. And this kind of view that one over the other is a very kind of risky strategy here. And getting that right recipe of combination is a critical one. The second summary point that I took away is the fundamental role of leaders, specifically in the area of learning, specifically in the area that Chandran mentioned about intellectual honesty, and specifically about this kind of view about serving a broader interest, serving a nation, serving the globe, et cetera, broadening of who they think they're serving overall. The third point that I got as a takeaway is our attitudes about enablers fundamentally drive either success or not. Our attitudes about technology and what it can be used for, but also to Chandran's point, don't overrate technology as a solution because it can create a false expectation of where things go. Our attitudes about business and what businesses do, our attitudes about our own nation, this view about exceptionalism, and exceptionalism, people like pride. Pride is important, but exceptionalism, if it blocks the ability to learn and get better and to grow, is not a good thing. And our attitudes about policy, public policy, and where it can be helpful. All of those things to me are major messages about our attitude. And then the final takeaway I got is about this outlook going forward. So the first one is Dr. Kim-Farley's view that actually, as an American, made me feel good. When he said we're at a 2 on a scale of 1 to 10, we should be getting to overall a 7 in where we're going to, and maybe we're at a 4 to 5 en route. But it's basically that there is a lot of hope and opportunity here, and don't forget the goal. Notwithstanding that we aren't at a 10 and probably won't get to a 10, don't forget the role of taking context and making things better. And then finally, the message that Jeongmin raised, that Lily raised, that Chandran raised, that these issues are global issues and not national issues. This isn't a rank order of countries and how well they're doing, et cetera, that as time goes on, these big looming threats and opportunities are global ones. And either we all are gonna work together and get a better outcome, or we're all gonna suffer, and we better start learning about the globe. So let me just close and say a huge thank you to each of you, to Chandran, to Jeongmin, to Lily, to Dr. Kim-Farley. I learned a lot. I think all of our participants learned a lot. I appreciate you being candid and open, because that's where learning is gonna come from. I wanna thank all of my colleagues at the centers at UCLA Anderson, Lucy Allard in our Center for Global Management, the Fielding School that's been a key partner of ours, and all of the people that participate. All of you are demonstrating an interest in learning and growing as participants. So a big thank you, and I hope to have all of us back together to see where we're progressing. Thank you very much.
Thank you.